Lung cancer. It's a chilling diagnosis.
Sadly, it is the leading cause of cancer deaths worldwide.
But knowledge is power, right? So we are going to do a deep dive into this subject today.
Yes. We'll try to equip you with as much information as possible.
Our source material today is a compilation of the latest research from the Mayo Clinic.
And we're going to unpack everything.
From early symptoms to preventative measures.
You know, one of the things that makes lung cancer so challenging is it often doesn't cause any noticeable symptoms in its early stages.
It's like a silent thief in a way.
Yes. Early detection is tough.
So what are some of those early warning signs? What should we be on the lookout for?
Well, I think it's important to note that the symptoms we are about to discuss can also be caused by other less serious conditions.
Okay.
But if you experience any of them, it's always best to err on the side of caution and consult your doctor.
Especially if you're a smoker or a former smoker.
Absolutely.
Okay, so what are some of the things we should be looking out for?
One of the most common symptoms is a persistent cough that just doesn't seem to go away.
So not your average, I have a cold kind of cough.
Right. If a cough lingers for weeks or months, especially if it's new or different from your usual cough, that's definitely something to pay attention to.
Okay, persistent cough. Got it. What else?
Chest pain.
Chest pain. Okay.
This can range from a sharp stabbing pain to a dull ache.
Oh, wow.
Sometimes it's worse when you breathe deeply or cough.
All right, so we've got a persistent cough, chest pain. Anything else we should add to this list?
Coughing up blood.
Oh, gosh. Okay.
Even a small amount is a serious sign.
Yeah.
And you should seek medical attention immediately.
For sure. Now, the Mayo Clinic materials we've been reviewing say that as lung cancer advances, it can start to spread to other areas of the body.
That's right.
What happens then? What kind of symptoms might start to show up?
Well, as the cancer spreads, you might begin to experience things like bone pain.
Okay.
Headaches.
Unexplained weight loss, maybe?
Unexplained weight loss, yes.
Loss of appetite.
Loss of appetite.
No.
And even swelling in the face or neck.
So it's not just limited to the lungs themselves. It can really manifest in different parts of the body, depending on where it spreads.
Exactly.
Now let's talk about what causes lung cancer to develop in the first place. What's going on at the cellular level?
At its core, lung cancer stems from changes in the DNA of your lung cells.
Okay.
These changes are also called mutations.
Right.
You see, DNA holds the instructions that control how cells grow and behave. When those instructions get messed up, cells can start multiplying uncontrollably.
Yeah.
And that's what forms a tumor.
Now, doctors often use a term called pack years to measure someone's smoking history.
Right.
Basically, you take the number of packs of cigarettes smoked per day and multiply it by the number of years a person has been smoking.
And unfortunately, smoking is the primary cause in the vast majority of lung cancer cases.
It's amazing how much damage something you inhale can do.
Those carcinogens in cigarette smoke, they're really the culprits. They wreak havoc on your lung cells.
And it's not just direct smoking that's a concern, is it?
You're right. Secondhand smoke is a major risk factor, too.
I've heard that even being around someone who smokes can significantly increase your chances of developing lung cancer.
It's true.
Now, what about people who have never smoked?
Unfortunately, lung cancer can still occur.
Oh, wow.
While the risk is significantly lower, it's not impossible.
So in those cases, is it harder to pinpoint the exact cause?
It can be, yes.
Okay, so we've established that smoking is a major risk factor,
Yeah.
but it's not the only one, right?
Right.
What are some other things that might increase someone's risk of developing lung cancer?
As we've mentioned, smoking history is the biggest one, both personal and secondhand exposure.
Right.
And the more you smoke, the greater your risk becomes. But the good news is quitting smoking, no matter how long you've smoked,
Yeah,
drastically reduces your risk.
that's encouraging.
You can actually cut your risk in half within 5 years of quitting.
That's amazing.
And there are so many resources available to help you quit. Counseling, medications, support groups.
So it is possible.
Absolutely.
What about other risk factors? Aside from smoking, what contributes to lung cancer risk?
Exposure to radon gas is a big one.
Radon gas.
Radon is a radioactive gas found naturally in the soil and rock,
Oh, okay.
and it can seep into homes.
Hmm.
Then there's occupational exposure to carcinogens, like asbestos,
Oh, right, asbestos.
arsenic, chromium, and nickel.
And are those especially concerning for people who also smoke?
Particularly for those who also smoke, yes.
Okay.
And then, of course, family history plays a role.
So it's a mix of genetics, environment, and lifestyle.
You got it.
And that's why it's so important to understand these risk factors. Knowledge is key for prevention, right?
It really is.
Now let's talk about some of the things people can actually do to protect themselves. We've already touched on quitting smoking, but what else can make a difference?
Minimizing exposure to secondhand smoke is crucial.
How can people do that effectively?
Well, asking family members to smoke outside is a good start.
Okay.
Or advocating for smoke-free policies at work and choosing smoke-free restaurants.
So really making conscious choices about the environments you're in.
Right.
Now, what about that radon gas?
The EPA recommends testing your home.
Oh,
It's a pretty simple test. You can even do it yourself.
okay.
Or you can hire a professional.
And if the levels are high,
There are systems that can be installed to reduce radon levels.
got it. So being mindful of our home environment is important as well. We always hear that a healthy lifestyle is good for overall health.
Absolutely.
Does that extend to lung cancer prevention?
Yes, it does. Eating a diet rich in fruits, vegetables, and whole grains is packed with antioxidants.
So that classic advice, eat your fruits and veggies, still applies here.
It certainly does. And don't underestimate the power of regular exercise.
Right.
Physical activity improves lung function and boosts your immune system.
So it all ties together. Now, before we move on, I want to circle back to something we talked about earlier. Lung cancer in non-smokers.
Okay.
What are researchers finding out about the potential causes in these cases?
That's a question scientists are still working to fully understand.
Okay.
But there are some promising areas of research that are beginning to shed light on this.
So what are some of the leading theories out there?
Well, one area of focus is genetics.
Genetics, okay.
Researchers are investigating whether certain genetic mutations might make some individuals more susceptible to lung cancer, even without a history of smoking.
So even if you've never touched a cigarette, you could still be genetically predisposed to this disease.
That's what they're trying to figure out. Another avenue of research is environmental exposures.
Okay.
We already know about radon, but scientists are looking at other potential environmental culprits too.
Like what?
Things like air pollution and asbestos exposure. Even certain chemicals found in some workplaces are being investigated.
So even if someone's never smoked, their environment could still increase their risk of developing lung cancer. It really emphasizes how connected our health is to the world around us.
It really does. And there's another piece of this puzzle that researchers are exploring. Inflammation.
Inflammation.
Chronic inflammation in the lungs, which can be caused by infections or autoimmune diseases,
Yeah.
could increase the risk of lung cancer.
So it's not just about external factors like smoking and environmental toxins.
Right.
It could also be about internal factors and what's happening inside the body.
Exactly. It's a really complex interplay of factors, and researchers are working hard to understand those connections.
Fascinating.
And finally, there's some research being done on the role of hormonal factors, particularly in women.
Yeah.
Some studies suggest that hormonal changes during menopause might increase the risk of lung cancer in women who have never smoked.
So many factors at play.
That's right.
It's amazing how researchers are piecing together this puzzle.
It's a constant process of discovery.
Now, let's shift gears a bit. We've talked a lot about risk factors and prevention, but I'm curious about diagnosis. If someone's concerned about lung cancer, what are the first steps they should take?
Well, if you're experiencing any of the symptoms we talked about earlier,
Yeah.
the first step is to see your doctor.
Okay.
They'll likely ask about your medical history, including any smoking history and potential exposure to radon or other carcinogens.
So just kind of gathering information.
Right. And they'll also perform a physical exam, listen to your lungs, check for any other signs or symptoms.
So starting with a conversation and a basic examination.
Exactly.
And then what?
Depending on their initial assessment, your doctor might order some tests.
Okay.
A chest x-ray is often the first step.
And that would help them visualize the lungs and look for any abnormalities.
Exactly. They'd be looking for things like a tumor or fluid buildup.
I see.
And if the x-ray shows anything suspicious, they might order a CT scan.
Oh, for an even more detailed image.
Right.
So those are imaging tests. Are there other types of tests that might be used?
Absolutely. A sputum cytology test
Okay.
examines phlegm coughed up from the lungs.
To see if it contains cancer cells.
Exactly. And sometimes a biopsy is needed.
A biopsy, okay.
That involves taking a small sample of lung tissue.
To examine under a microscope.
Yes, to confirm a diagnosis.
So it's a step-by-step process.
It is.
Starting with a conversation with your doctor, then potentially moving on to imaging tests.
Right.
And maybe even a biopsy to get a definitive diagnosis.
It can be a lot to process.
Yeah.
But understanding these steps can help you feel more prepared if you ever need to navigate this path.
That's so true.
And remember, early detection is key.
The earlier, the better.
Always.
That brings us to lung cancer screening.
Right.
You mentioned that briefly earlier, but I'd love to hear more about it.
Sure.
Who should consider getting screened?
Lung cancer screening is a preventative measure for people at high risk. The U.S. Preventive Services Task Force recommends annual screenings for adults aged 50 to 80 who have a 20-pack year smoking history.
So if you're an older adult with a significant smoking history, this is something to talk to your doctor about.
Absolutely.
Okay.
And these screenings use a low-dose CT scan,
Right.
which exposes you to less radiation than a standard CT scan.
Got it. And what are they looking for in those scans?
They're looking for any suspicious nodules in the lungs.
And this could really help catch lung cancer early when it's most treatable.
Right. It has the potential to be a game changer.
No, we've talked a lot about not smoking.
Right.
That's the most important thing a person can do.
Absolutely.
But what other lifestyle choices can help protect our lungs and overall health?
Well, you're right. Not smoking is the biggest gift you can give your lungs.
Yeah.
But even if you've never smoked, there are still things you can do.
Okay, like what?
Maintaining a healthy weight through diet and exercise is key.
Hmm.
It benefits your whole body, including your lungs.
So back to the basics.
Back to the basics.
Eating right, staying active.
Exactly. And remember radon.
Oh, yeah, right.
If you haven't tested your home, it's a good idea to do that.
And that can give you peace of mind or at least motivate you to take action if needed.
Right.
It's about being proactive.
We can't eliminate all risks, but we can certainly minimize them.
That's empowering.
It is.
This deep dive has been incredibly informative. We've gone from those subtle early symptoms to the diagnostic process
Yeah.
and even touched on the latest research.
There's so much valuable information out there.
I hope this encourages our listeners to prioritize their lung health.
Me too.
But before we wrap up, I want to leave our listeners with something to think about.
Okay.
Knowing what we've discussed about the risks and the steps you can take to protect yourself, what's one small change you can make today to benefit your lungs?
That's a great question to consider.
Maybe it's finally committed to quitting smoking,
Maybe.
or having a conversation with a loved one who smokes,
Could.
or scheduling that radon test you've been putting off.
Or just adding some extra fruits or veggies to your plate.
I love that. Small, consistent actions.
Every little bit helps.
And if our listeners want to delve deeper into this subject, we've got lots of resources from the Mayo Clinic.
We'll include those links in the show notes.
Perfect. So listeners, we encourage you to keep exploring this information because knowledge is power when it comes to your lung health. Thanks for joining us on this deep dive. Until next time.
Stay curious and stay healthy. They're trying to determine if that's the case. And another area of research is environmental exposures.
Ah, okay.
You know, we've talked about radon, but scientists are looking into other potential environmental culprits too. Things like air pollution,
Okay.
asbestos exposure, even some chemicals found in certain workplaces are being investigated.
So even if you've never smoked, your environment could still play a role in increasing your risk of developing lung cancer.
That's right. It underscores the interconnectedness between our health and our surroundings.
I think that's a really important point.
Now, there's another piece of this puzzle, and that's inflammation.
Inflammation, okay.
Chronic inflammation in the lungs, which can be caused by infections or autoimmune diseases,
Right.
might also increase the risk of lung cancer.
So it's not just external factors like smoking or environmental toxins.
Exactly.
Internal factors and what's happening inside the body could be just as important.
You got it.
It's fascinating how many different factors could be involved.
It really is a complex interplay, and researchers are working hard to untangle all of these connections. Oh, and I almost forgot. There's also some interesting research going on about hormonal factors, particularly in women.
Okay.
Some studies have suggested that the hormonal changes that happen during menopause might increase the risk of lung cancer.
Specifically for women who have never smoked.
That's right.
So many different pieces to this puzzle. It's amazing how research is helping us understand this disease better.
It is. It's a constant process of discovery.
Speaking of understanding, I'd like to shift gears a bit now and talk about the process of diagnosis.
Okay.
What should someone do if they're concerned about lung cancer? What are those first steps?
Well, if you're experiencing any of the symptoms we discussed earlier, the
Sure.
first step is to see your doctor.
Makes sense.
They will likely ask about your medical history,
Okay.
including any smoking history and potential exposure to radon or other carcinogens.
So gathering information, basically.
Right. And they'll also do a physical exam.
Okay.
Listen to your lungs and check for any other signs or symptoms.
So starting with a conversation and a basic examination,
Exactly.
what happens next?
your doctor might order some tests, depending on their initial assessment.
Okay.
A chest X-ray is often the first step.
And that helps them visualize the lungs.
Yes, it can show things like a tumor or a fluid buildup.
Got it. And what if the X-ray shows something suspicious?
Then they might order a CT scan to get a more detailed picture.
Okay.
So we've got imaging tests.
Right. Are there other types of tests they might use?
Absolutely. There's a sputum cytology test.
Sputum cytology.
Okay. That involves examining phlegm coughed up from the lungs.
To see if it contains any cancer cells.
Precisely. And then in some cases, a biopsy might be necessary. And that involves taking a small sample of lung tissue to examine under a microscope.
To confirm a diagnosis of lung cancer.
Right.
So it's a multi-step process.
It is.
Starting with talking to your doctor, then maybe some imaging tests. And sometimes even a biopsy.
It can feel overwhelming, but understanding those steps can really help you feel more prepared if you ever have to go through this.
I agree. Knowledge is power in these situations.
It really is. And remember, early detection is so important.
The earlier the better, right?
The earlier the better.
Which brings us to lung cancer screening.
Yes.
We touched on this briefly earlier, but I'd love to hear more about it.
Sure.
Who should consider getting screened for lung cancer?
Well, lung cancer screening is a preventative measure.
Okay.
It's for people who are at higher risk.
Got it.
The U.S. Preventive Services Task Force
Yes.
recommends annual screenings for adults aged 50 to 80
Okay.
who have a 20-pack-year smoking history
So older adults.
and who currently smoke or have quit within the past 15 years.
So if you fall into that category,
Right.
an older adult with a significant smoking history,
Definitely talk to your doctor about lung cancer screening.
it's good to be proactive. Now, what does the screening involve?
They use a low-dose CT scan,
Okay.
which exposes you to less radiation than a standard CT scan.
Got it.
And they're looking for any suspicious nodules in the lungs.
And that could potentially help catch lung cancer at its earliest stages.
It could be a real game changer.
We've talked a lot about the importance of not smoking,
Of course.
but what other lifestyle choices can people make to protect their lungs?
Well, not smoking is the best thing you can do for your lung health.
Yeah.
But even if you've never smoked, there are still steps you can take. Maintaining a healthy weight through diet and exercise.
Okay.
That's key.
So those basic healthy habits we hear so much about.
Right. Eating right and staying active.
But this time with the added bonus of potentially reducing your risk of lung cancer.
Absolutely. And we talked about radon earlier.
Mm-hmm.
If you haven't tested your home, it's a good idea to do so.
Right.
It's a simple step you can take.
It's all about taking control of what we can control, creating a healthier environment for ourselves and our families.
It's about empowering yourself.
Yeah.
We can't eliminate all risks,
Right.
but we can certainly take steps to minimize them. It really is.
This deep dive has been eye-opening. We've covered so much.
We have, from those early symptoms, which can be so subtle,
Right.
to the complexities of diagnosis.
Mhm.
And we've even touched on the latest in research and prevention strategies.
It's been a lot to take in, but I feel like I have a much better understanding now.
And I hope that newfound understanding will encourage our listeners to take charge of their lung health.
Absolutely. But before we wrap up,
Yeah.
I want to leave our listeners with something to think about.
Okay.
Knowing all that we've discussed today, all the risks and those powerful steps we can take to protect ourselves, what's one small change you can make today
That's a great question.
to benefit your lungs?
It really is. Maybe it's finally committing to quitting smoking,
Yeah,
or finally having that conversation with a loved one who smokes.
it could be.
Maybe it's scheduling that radon test you've been putting off.
Right.
Or even just adding an extra serving of fruits and veggies to your plate.
I love that. Just those small, consistent actions.
Every little bit adds up.
And remember, if you want to explore this topic further, we've got lots of resources from the Mayo Clinic available.
We'll include those links in the show notes for easy access.
Perfect. So to our listeners, we encourage you to keep learning and stay informed, because when it comes to lung health, knowledge really is power.
It empowers you to make the best choices for yourself.
Thanks for joining us on this deep dive. Until next time, stay curious and stay healthy.
We'll see you on the next deep dive.